Hello, and welcome back to the Arlington 60 Plus Connection. I'm Christine Shaw, Executive Director of the Council on Aging here in Arlington. We're thrilled to have you back for another episode of our show, sharing all of the different information, activities, and programs that are relevant to seniors in Arlington. So welcome. Today we have a great show lined up for you. We will be chatting with Kim Aruth from Visiting Nurse and Community Care about their organization and what they offer here in Arlington. That is exciting. And we will also be talking about all of the exciting programs we have coming up for the start of the winter season. It is hard to believe that the holiday season is almost upon us. When you are watching this, I hope that the weather is not too cold or snowy for you to be able to get out, and that you can start to enjoy the change of seasons. We are preparing here at the Council on Aging for some winter activities, and I'm thrilled to share that we have secured Town Hall Auditorium as an indoor location for some of our programs. As you know, we are under construction here at 27 Maple Street. It is progressing along, and as you all know, it is extremely delayed. We cannot wait to welcome you here once the construction is complete. But in the meantime, we decided to take it upon ourselves to use Town Hall Auditorium so that we can all meet together in person if that is something you're interested in. We will go into details during our newsletter corner with what exactly we're going to be doing in person and also what will stay virtual. So that is coming up later in the show. One other thing I wanted to mention was regarding vaccines and COVID-19 boosters and also flu vaccine. If you are interested or still need to receive your flu vaccine for this year or your booster for COVID-19 vaccine, please feel free to give our office a call. It is ever changing with when we are offering clinics and when we are referring people to local pharmacies. So we will be sure to give you the most up-to-date information and help you get your booster or flu shot. Our nurse, Joanne Sliney, is also available to help if you are homebound and receive your vaccines at home. So please give us a call, 781-316-3400, and let us know how we can help you with your vaccines. And we're happy to do that. And without any further ado, I am thrilled to bring onto the show Kim Aruth, here with us from Visiting Nurse and Community Care. Kim and I had met just before the pandemic. She came into our offices. We had kind of some big plans for how we were going to work together, and then the pandemic happened. Exactly. So we are thrilled to kind of get back together. Thrilled to have Kim on the show so she can talk to us about Visiting Nurse and Community Care and really what they do in Arlington. So welcome, Kim.
Thank you. It's nice to be here. I appreciate it.
Great. So first, for those who don't know, I know a lot of people know the term visiting nurses, but what is Visiting Nurse and Community Care in Arlington?
Okay, so Visiting Nurse and Community Care, we are the community home health agency, if you will. So a home health agency, we're community-based, we're independent, we're nonprofit. And a home health agency, when you speak to home health, it really refers to your visiting nurses, if you will. So we have the visiting nurses and we have the therapist. That's the physical therapist, the occupational therapist, your speech therapist, and social work services. We're fortunate within our home health agency, we have 3 divisions, that being the home health. Then we have our personal care private pay division. And that division is where we have a number of certified home health aides who go out and provide personal care.
Great.
That being private pay, it is just that, private pay. Our 3rd division is our end of life or our hospice division. And again, how I explain Visiting Nurse and Community Care is that we're a puzzle and we have a piece of the puzzle for a family who may transition from one end of the spectrum to another. So whatever that puzzle might look like for a family, we have the pieces to fill it in.
Okay.
What I mean by that is with our home health division and the VNA, people will know, they'll know the term visiting nurses. A referral for the VNA comes from a physician when someone's been in a hospital or a rehab and they're being discharged home. So when they come home, if we were, called and said, we need you to take care of so-and-so, we would see that patient the next day. And those services from a home health from a home health perspective are covered under insurance.
Okay.
Whatever Medicare, Medicaid, we accept any other private insurance there is. But those services are covered for your visiting nurse and your therapists.
Oh, that's great.
Yes. So that's how usually someone enters into, our community, if you will. At a certain point in time, unfortunately, insurance will only pay so far along the line. Hopefully that person will deem that, they're ready to be discharged. Some families feel they need a little bit more help after that discharge. And if they do, that's where our private pay division can come in and provide some additional personal care or companionship or oversight via a certified home health aide.
So what, I know people might be more familiar with physical therapy after a surgery or occupational therapy if their doctor says it's something they need. But when you talk about the home health aid services that people might be interested in starting, what does that look like? What types of things do those people do?
Sure. So our certified home health aides, it's primarily personal care.
Okay.
They'll assist someone with a sponge bath, bathing, shower if it's safe and if someone is able to do that, dressing, ambulation, keeping someone safe when they're ambulating, meal prep. I always say we're not gourmet cooks, but basic meal preparation and also light housekeeping. And I also preface we're not Merry Maids, but the home health aides can do, cleaning up after the bathroom's been used, after a meal's been prepped in the kitchen, change sheets for someone, do laundry. Those are the services that fall under what a home health aide can do.
Oh, good. And when you're getting calls for people interested in home health aid services, is it usually the person that's calling for themselves, or do you get mostly calls from children or neighbors that might be calling for somebody else?
I'm going to say probably the majority is from family members, whether that be a son, daughter, niece, nephew. Yes, so they'll be inquiring for their loved one. Sometimes it's the loved one who feels they don't need any additional assistance. But, they've come to realize that they do. So it will be the caregiver at that point in time, if you will, again, the family member who will make the call. That call gets directed to the private pay division. Our nursing manager will take that call, schedule a complimentary assessment to go out to the home, meet with the caller who's calling in, and hopefully the individual will be providing care for. She goes over an assessment, does a house check to see if, we feel any safety measures should be in place, and then explains the services that we provide, through our home health aides.
That's great. That's really great to know. And I know it's a lot of times those are services that people don't know who to call once they think they might need some help. And I know you mentioned companionship as well. And we do frequently get calls from people who really are just looking for, sometimes they use the word companion. Sometimes they say like a visitor or somebody to check in on them. What are some of the things that a companion visit would look like?
So a companion visit is just that. It's companionship. It's not hands-on care. So that's the difference between a home health aide and a companion. Okay. Home health aide can touch, provide personal care. Companion does not touch. They are there to keep someone company. They could do meal preparation. They could escort that individual to a medical appointment if the family wanted that to take place, or just take someone shopping.
That's really great to know. Yeah, and we do have some volunteers that help people with those sort of things, but sometimes it's beyond the level of what a volunteer can commit to as far as the amount of time or generally kind of what's involved. So it's great to know that we have a partner in the community that people might be able to reach out to. So Kim, we'll mention it a couple of times, but what should people do if they want to contact you? What's the best way for them to go about it?
Most certainly call the office, and our number is 643-6090. There'll be options for what department you would want to pick the option for. If you were looking for a home health aide, that'd be the private pay division. If someone had any questions about someone being discharged from a hospital or rehab and wanting services, that would be the intake option. And they're noted very clearly when someone calls in.
Great. And I know we talked a lot during the time that vaccines became available for your workers to get vaccinated, but it makes me think COVID really must have impacted your business quite a bit. What is different now that maybe since COVID started for you and your line of work?
Well, it's realizing, I guess I don't like the word fear, maybe apprehension is a better word, of families and letting someone into their home. Not knowing, is someone vaccinated, are they not vaccinated? We are, as a home health agency, everyone is vaccinated within. There is some new requirements that are rolling out as we speak in regards to what the mandates are for certain businesses. We fall under the mandates for Medicare, CMS. So those are probably your most strict regulations, and that's what we fall under and we follow. All of our home health aides are vaccinated. So, families can feel, assured that we're sending in an individual who has been vaccinated. Also, our home health aides are all provided with the PPE that is necessary. We've been very fortunate from the get-go that we, knock on wood, we had plenty of PPE. Yes, so our home health aides, our visiting staff, including our nurses and our therapists, are all vaccinated and, again, are all equipped with the proper PPE that is necessary. So families can be assured that, again, they don't have to worry about that. Has someone been vaccinated or have they not been? Everybody has been vaccinated.
That's great to know. And I'm sure that's great for people to hear that are watching. And my only other question is, I've heard that there's right now a shortage of home health workers. Are you experiencing that at your organization?
Yeah, we are.
Yes.
We are. Yes. And again, needing to have everyone vaccinated, it makes it a little bit more challenging. Okay. But we're finding recruitment is an issue. As in any other industry, it's just not ours by any means, recruitment. Absolutely. I think everyone sees, hiring now in every window you go by. So yes, recruitment is a challenge right now. And, having enough, honestly, home health aides to fill, the cases that we want to is challenging. Yeah, so we're just moving on and just taking, one day at a time, and we're constantly recruiting.
Yeah, that's great. So if you're watching this show and interested in becoming possibly a home health aide or companion for somebody, maybe it would be it's kind of a nice thing to do that is a career change for some people, or if they're in a position where they're looking for employment, would they be able to reach out to you as well, Kim?
Absolutely. We don't train on site, but we most certainly can share information where we know there are training sites available, and can most certainly pass that information on. But if someone is a certified home health aide or a certified nurse's aide, yeah, please don't hesitate to call. Again, the number is 781-643-6090. We're also recruiting nurses and therapists. So yeah.
That's great to know. And really, is there anything else you wanted to share, Kim, before we move on? I'm thrilled you were able to come on the show today.
No, I appreciate it. I'm excited for your Ascented to be completed. That's going to be exciting. Visiting Nursing Community Care, my goal as CEO is just really, we want to become part of the community. We were formerly, just a little history, the VNA in Arlington was known as VINCH, Visiting Nursing Community Health. VINCH and Greater Medford VNA merged in 2017, hence now we're Visiting Nursing Community Care. So I just want to reestablish our real, commitment to the community and to you and your center and your community. And yeah, we're more than happy to do whatever we're able to do as far as public service, programming, etc.
That's great. And there will be a lot of opportunity for programming and for you to come to the center and integrate with our staff and our residents that will be using it when it's completed. We can't wait.
Super. Well, again, thank you for having me on. I appreciate it.
Thank you, Kim, for being here. I appreciate it. Good talking to you.
You too.
Thanks. It's always interesting to hear the different organizations around Arlington that we can partner with to make the lives of older adults just a little bit easier. And really on this show, that's what we hope to do, is put the pieces together. Kim talked about her organization as a puzzle, and I kind of see the Council on Aging as a piece of a puzzle too. And if you have questions about things like home health aides or physical therapy or occupational therapy or companionship, and you reach out to us, Visiting Nursing Community Care might be one of the organizations that we refer you to. So it's great to talk to Kim today and hear a little bit more firsthand about what their services are. And she shared her contact information, but you are always welcome to reach out to us if you have any further questions about the services that they offer. So again, thank you to Kim for being on the 60 Plus Connection this month. I am now excited to reintroduce Chris Angel. She is here for our newsletter corner portion of the show.
Hi, Christine.
There she is. We are ready for the December newsletter to be launched. There she is. Beautiful.
I'm still working on it. Don't look.
That was a sneak peek. So Chris, what do you have to share with us for December? Can't believe we're talking December.
Okay, well, I'm excited because we do have a lot of in-person activities. Our center is still closed, but we are lucky we've gotten some permission to use some space inside of Town Hall. So we are able to provide a fair amount of in-person programs right now. And my favorite one, do you like coffee?
I love coffee.
So do I. I like coffee and I like talking. So come to our cozy coffee hour on December 9th. December 9th in the morning, we're going to have coffee and sweets. And it's a great way to get out, see people that you used to know from the senior center, or if you're new in town, or if you didn't go to the senior center when we were open before, this is a great way to meet new people. It's also a great way to meet our staff and find out what the Council on Aging does. So cozy coffee hour on December 9th. All the time.
We always have a good response to coffee hours. People love coffee hours. We're trying not to make it overly fancy or complicated, but we know you love coffee hours.
And really, we're not doing it for the coffee. We're doing it to see each other. So another thing I want to bring up where we can see each other in person, we have a really neat, finally in-person art class. It's expressive art therapy with Erica. We've been doing it online during the whole pandemic, but now we're finally going to be able to do it in person. And Erica will be at Town Hall on December 16th. And I want to just say, even if you don't think you're very creative or you're not super into art, I think this would be a great thing to come to, a good way to spend time with other people and make a card. It can be for any occasion, and just a way to get out and see what we're offering, meet people from the Council on Aging. So that will be in the newsletter, and call us. Yeah, call us if you need any information. Then we have also in person the singing group, the Maple Street Singers, who are part of the Arlington Senior Association. They're going to be back in person. They've also been meeting virtually the whole time. And we had Sherry Minton on the show a few months ago talking about that. So they're going to be back in person once a month, also at Town Hall. So if you would like to think about joining a singing group, that information is going to be in the newsletter. Also, we have a book club starting up. Now, this is not until January, but just keep it in mind, we're going to have a monthly book club. That was something that the Arlington Senior Association ran before the pandemic, and now we are starting it live again, also in Town Hall. That information will be in the newsletter. We have 2 in-person yoga classes every Tuesday.
Yep.
And also, for a little bit more exercise, every Thursday, we're going to have mall walking. We've been doing a walking club all summer, And now we're going to move indoors. It's getting a little cold out there. So we're going to be doing that every Thursday. We're going to be doing mall walking, except for the Thursday when we're having our cozy coffee hour. So you don't have any excuse to miss the cozy coffee hour because the walking club is canceled that day. So, but not everybody is ready to go outside. And, some people just want to be indoors right now. It's getting cold. So we still have all of our exercise classes available online, just as we have been during the whole pandemic. But we do have a new online exercise class called Ageless Grace. So if you're looking for something different, there's a little bit of explanation about that in the newsletter, and that's every Tuesday, and that is online. So you can do that from the comfort of your own home.
I've heard great things about Ageless Grace. It's supposed to be a great program that's a little unique and different than what you're used to with exercise.
And it's taught by Maria Skinner, and she is certified in teaching Ageless Grace. So that is a little bit different than some of the other exercise classes that we have. So there's, if you're interested in exercising and you want to do it from home, I would just call or email Shannon Murphy, as always, for all of our programs, and just check this class out, because this could be something you could add to your daily, weekly schedule every Tuesday. And then I just wanted to remind people, another virtual program that we're having is our intergenerational book club. This is different than the book club that's going to be in person. This is a book club that we do with Arlington High School students. So that's kind of neat. You get to meet young people, talk about books. It's, we're hoping to do it in person again, but right now it is still virtual. So that's kind of nice. If it's kind of crummy weather out, you can stay inside and talk about books, and also meet some, get some young people's perspectives as well, and share your perspective with them, which is a big part of what we're doing, why we're doing that, the intergenerational program. And then another thing I just want to bring up, the holidays are coming up, things are getting busy. A lot of us have still been isolated. So some of us are needing a little bit of extra support right now. You want to talk with people, some things that are going on. So I just want to remind everybody, we've talked about this before, but the Council on Aging has several support groups for different issues. So I just want to remind you, we have a caregiver support group, which is run by our awesome social worker, Lori August. That's virtual right now. Is that virtual, Christine, or have we done that live yet?
Yes.
Okay, it's virtual.
Yep.
All right. Virtual. Sorry, I have so much going on. All right, and then we have a support group for the vision impaired. So some people have had vision issues for their whole life. Some people are struggling with new vision issues. So this is a great group, also run by Lori August, the vision impaired group. We also have the clutter group run by Marcy, our other awesome social worker. People might need to get on top of the clutter they've built up over this time during the pandemic. So something to think about with Marcy. And also our awesome nurse, Joanne, is running the Parkinson's support group. So that is probably going to be once a month. So you can call our main number for any of these programs and we'll get you to the right place. And so if you're just looking for some extra support, I hope that you will think about calling us. If you want to get out and go to a program, I hope you'll think about calling us. And if you want to stay home and do some things online, I hope you'll think about calling us, because we have a lot to offer.
Yes. So much to offer, Chris. Thank you so much for going through all of that. This is a time when we have the in-person things coming back and we have the virtual things going on. So there is something for everybody.
I have to say one thing. I just want to remind everybody. I think anybody that lives in Arlington knows that we do have a town mask mandate. So any of our in-person programs, you might have said it at the beginning of the show, I'm not sure, but we will need to wear our masks. That's not a Council on Aging rule. That's a Town of Arlington rule. So just remember, any of the programs you're coming to, bring your mask and plan on wearing it the whole time, except when you're like sipping your coffee. And if you forget your mask, we will give you one. But I do want to remind everybody that will be something that they'll need to remember to do.
Yeah, that's a great reminder. Thank you so much, Chris. And it is so nice when our building is right behind town hall, but just being able to pop over to town hall now and seeing people in person again. I went over there the other day and there was both yoga classes going on. There was bustling in between each. And then we had our intergenerational tea talk right after. So
Yeah,
we're
awesome.
getting to the point where we're seeing people that are ready to come out. And if you're not, you heard Chris mention all of those awesome virtual programs. So Chris, thank you so much as always. So
We
much
want
to
to see
share.
old friends come back, and we want to see new friends come and find out what we're all about.
Absolutely. Yeah, we can't wait to meet you or see you again soon. So, Chris, thanks for being here as always for the newsletter corner. Perfect. And it is really great to see us transitioning back to more in-person events. Our center here is not ready yet, so we are going ahead and doing them at Town Hall, as you have heard. As soon as our construction is done, we will have our programs back here. There will be plenty of space, plenty of beautiful space for all of these programs to happen in as well. And don't worry, we will not be cutting off the virtual programs for those of you who are still feeling safer at home. The last thing I want to mention, since it is December, we will be launching our Warm Wishes holiday gift bag program again this year, and we will have volunteers delivering winter gift bags and cozy packages to people around town. If you are interested in volunteering to help us out with this, please call our office, 781-316-3400, and we will put you in touch with our volunteer coordinator to help with this program. I think this is our 4th year doing it, and we are thrilled to offer it again this year. That said, I would like to close out this episode of the Arlington 60 Plus Connection. Please reach out to us and talk to us soon. I'm Christine Shaw, the Executive Director of the Council on Aging, and I'm happy that you were able to watch.